Before we begin today's video, let's practice a bit of mindfulness. Firstly, look at the screen, then slowly close your eyes. And as you do, just leave your mind blank. Then, take in a deep breath through the nose, slowly, then out through the mouth. One more time, in through the nose, and out through the mouth. And one last one. Now slowly open your eyes, and let's begin today's video. In today's video, we are going to be talking about the foot's anatomy, common injuries, as well as rare injuries. I will name and explain each part of the foot listed on screen today. Phalanges. Every other finger and toe has 3 phalanges: the proximal phalanx, the middle phalanx, and distal phalanx. And the phalanx is the singular form of phalanges. The phalanges of the fingers help us manipulate our environment, while the phalanges of the foot help us balance, walk, and run. The metatarsal bone. The metatarsal bones are a group of 5 long bones located in the metatarsus of the foot, between the tarsal bones near the ankle and the phalanges, toe bones. These bones are numbered from 1 to 5, starting with the first metatarsal beneath the big toe and moving laterally towards the 5th metatarsal beneath the little toe. Each metatarsal bone has 3 distinct parts: a proximal base that articulates with the tarsal bones, a slender shaft in the middle, and a distal head that connects to the proximal phalanges of the toes. Each base of the metatarsal bone articulates with at least one of the tarsal bones, forming the tarsal-metatarsal joints. The head of the metatarsals articulate with the phalanges, making up the metatarsal-phalangeal joints. The metatarsals play a vital role in forming the arches of the foot that are essential for weight-bearing, balance, as well as walking. The calcaneus or heel bone. The calcaneus is one of the 7 tarsal bones and the foot's largest bone. It plays a significant role in supporting the weight of one's body while standing or ambulating. Additionally, several muscles that originate or insert in the calcaneus aid in various foot movements. Cuneiforms. The cuneiform bones form a unique series of bone tightly bound together and function as a unit. They articulate with the navicular proximally through 3 separate facets and with metatarsal segments distally. Laterally, the third cuneiform articulates with the wedge-like medial third of the cuboid. The tibia. As a weight-bearing bone, the tibia is integral to movement. It transfers the weight of the body from the knee to the foot. The tibia also provides attachment points for muscles and ligaments, contributing to the stability and movement of the leg. The navicular bone. The navicular bone is one of the 26 bones of the human foot. It's important for connecting the ankle to the lower bones in our feet and helps form the arc that enables us to walk. It is prone to stress fractures, especially by athletes, while kicking, sprinting, twisting, or falling. Talus. The talus is the bone at the top of the foot that serves as a perch for the tibia and holds the weight of the entire body. The talus is considered a short bone and is one of the main bones of the ankle. In this chapter, we're going to be talking about common foot injuries. Sprains. Sprains are often caused by twisting or turning the foot awkwardly, leading to stretched or torn ligaments. The most common sprain is an ankle sprain. Fractures. Fractures are breaks in the bones of the foot, such as those in the toes, toe fractures, or the metatarsals, mid-foot bones. Stretch fractures, often from overuse or repetitive stress, are also common. Bunions. A bony bump that forms at the base of the big toe often due to genetic factors or ill-fitting shoes. It can cause pain and deformity. Heel spurs. Heel spurs are bony growths on the underside of the heel bone, often associated with plantar fasciitis. They can cause pain, especially when walking or standing. Achilles tendinitis. Achilles tendinitis is an inflammation of the Achilles tendon, which connects the calf muscles to the heel bone. It's often caused by overuse or sudden increases in physical activity. Plantar fasciitis. Plantar fasciitis is an inflammation of the plantar fascia, the tissue that runs along the bottom of the foot from the heel to the toes. It causes heel pain, particularly noticeable in the morning. Ingrown toenails. Ingrown toenails occur when the edge of the toenail grows into the surrounding skin, leading to pain, swelling, and sometimes infection. Morton's neuroma. Morton's neuroma is a thickening of the tissue around the nerve between the toes, usually the third and fourth toes, causing pain and numbness. In this chapter, as you probably already noticed from the title chapter, we're going to be talking about rare foot injuries. Lisfranc injury. Lisfranc injury is an injury that involves damage to the Lisfranc joint complex, which includes the metatarsals and the tarsal bones. It can result from a high-impact trauma or severe twisting force. Symptoms include pain in the midfoot, swelling, and difficulty bearing weights. Tarsal coalition. Tarsal coalition is a condition where two or more of the tarsal bones in the foot fuse together abnormally, which can cause pain and restricted movement. It's usually present from birth, but may not be symptomatic until later in life. Navicular stress fracture. The navicular bone is one of the key bones in the midfoot. Stress fractures here can occur due to repetitive stress or overuse, and they can be challenging to diagnose because they may not always be visible on standard x-rays. Freiberg's disease. Freiberg's disease is a condition where there is a loss of blood supply to the head of one of the metatarsal bones, usually the second, leading to bone death and potential collapse. It's more common in young adults and can cause pain and swelling in the forefoot. Kohler's disease. Kohler's disease is a rare condition typically affecting children. It involves a vascular necrosis of the navicular bone in the foot. Symptoms include pain and swelling, and it can affect a child's ability to walk. Danter's fracture. Danter's fracture is often confused with other types of foot fractures. A Danter's fracture specifically refers to a break in the base of the fifth metatarsal. It usually results from an inversion injury or a sudden, high-impact movement. Heel pad syndrome. Heel pad syndrome, although not as rare, is a condition that involves damage to the fatty padding on the heel, often due to repetitive impact or pressure. It can cause heel pain and discomfort. Accessory navicular bone syndrome. Some people have an extra bone in the foot called an accessory navicular. While it can be asymptomatic, it may also cause pain or irritation if the extra bone is involved in a stress injury or inflammation. We have now reached the end of today's video. Like I say with almost all my videos, I would like to thank you for watching and really appreciate it. Basically, I know I'm repeating myself, but thank you for watching because it really helps me out a lot. And since you made it this far, you might as well just go like and subscribe. That also helps me out a lot. And have a great day.